I hope this will not continue because I can see shaking. Anyhow, so I'm starting. My name is Yahya Isawi, and I am a consultant neonatologist, and I'm a research advocate. And today is the second session of a series of presentations about conducting research. We started with the first session, which is how to generate a research question, and today we'll be talking about how to read an article. And my objectives in today's talk is to read an article in a systemic way, and I will give you the structure of an article, including introduction, method, abstract, result, discussion, and then how to make a final opinion about an article. And hopefully, at the end, I can do some practice with you. So let me kick off this presentation by asking you a question: what is slow but active reading? Any volunteer to answer the question? Any volunteer? The question is, what is slow but active reading? You guys hear me?
I can hear you. I can give an answer.
Answer the question. Can you?
That you read in a slow way, but in order to understand what exactly you are reading. It's not like a newspaper reading.
So because the title of the topic is timely and effective reading. That does not mean hurry meeting. Does not mean rush meeting.
Yes.
Okay? So you need to read slow, but you did not answer the question, but you have the idea, but not the question. So mute yourself, you will understand it. So reading the article is composed of title. And remember, we've talked in the first session that we assess the title by PICOT, the acronym PICOT. And the second in the article is, after the authorship, is the mute yourself, please. And mute yourself, please. Okay. So the second is the abstract. The abstract, when you read an article, you need to read the entire. Please mute yourself. You need to read the entire abstract, and then you go to the background. You don't need to read it all. You just need to read the last part of it. So please mute yourself. Oh, let me mute everybody. I'm muting, and then you unmute yourself. Mute, and then you guys mute and unmute yourself. And the second part is the method. Please mute yourself. When you read the method, you rescan it. And after you go to the method, you go to the results. And the result you read, you need only to review the table, the charts, and you don't need to read it. The last part, if you don't understand, you have to go back to the method and the result. So how you read an article, you go to the title, then go to the abstract. And then on the background, you need to, if you continue, I have to lock everybody. So please mute yourself. I have to stop the talk, and then I have to mute everybody. Okay. So again, title, abstract entire, last part of the paragraph, scan the method, look at the chart and the table of the results, and go back to the method and result if you don't understand. So how you do that? If you don't understand, then you need to go to the entire articles. When you do that, you do slow but active reading. How do you do that? You ask what? Please mute yourself. Ask what, who, when, where, how, and why. And when you do that, you need to fill the gap, the question that you are answering, and take notes. And you look up any words or paragraph you don't understand, probably you need to search it. So, I'm going to ask you a question. What is the structure of the article? Any volunteer to answer the question? What is the structure of an article? Any volunteer? Any volunteer? Okay, I will move. Faiza Khattab, you are opening your mic, so please mute your mic. Faiza Khattab. So the structure of the article composed of the title and then the abstract. Please, Faiza Khattab, please mute your mic. So the structure of the article composed of the title and the abstract. And then you have the introduction, and the introduction gives you the purpose of the study, the aim of the study, and the objectives. While the background gives you the literature review. So the literature review is very important when you read an article. And the literature review gives you what is known about that ticket, that title. And then it tells you the gap between what is known and what is unknown. So what is known is the literature review. What is the gap is what the researcher will do to fill the gap between the known and the unknown. And the unknown is what is the researcher need to achieve. So you have known, you have unknown, and then the researcher will do something to fill that gap. That is mentioned in the background. And then you go to the method. The method gives you the research design. And the research design is vital because it can tell you the outcome, it can tell you the bias if there is, the talk about the subject, the inclusion criteria, the exclusion criteria, and so on. So the design of the study is vital. The method also tells you how to select, how the subject, how the population are being selected, randomization, selection, enrollment, recruitment, and so on. It also tells you how the data was gathered, and then how the data was analyzed. So we have the introduction, the background, the method, and in addition to the title and abstract, we'll have the result. And the result tells you, gives you a table, gives you graphs, gives you facts. So in the result, there is no discussion. It just gives you whatever found in the study. And then from the result, you move to the discussion. And the discussion is the most volatile type of the study. So it tells you the finding, so you can see some copy from the result. And then it compares it with what is known, okay, with the literatures. So comparing the finding of the result compared to what is known at the first part of the introduction. And also, it tells you the impact of the study. What is the study doing? What is looking for? What is the effect of that study on our practice? And it might give you some hint for further study, for some suggestion. Okay, so again, the structure of article composed of the title and the abstract with the introduction, background, method, and result and discussion. Now, some people say, what is the difference between introduction and background? Most of the, we'll talk about this, but most of the medical research combine both, and we'll talk about it. So again, the structure of the article is introduction, background, method, result, and discussion. Now, the question is, I have an asked question, and if I'm a volunteer, why and how the structure of an article varies between one research and another? Any volunteer? Any volunteer? Anybody can answer the question. Why and how the structure of an article varies? Introduce yourself and answer.
You say how the structure of article varies. I think it varies according to the study design, whether it is a kind of study.
No, I don't think it's related to the study design.
Yeah, I think Muhammad Salman.
Yes.
I think the general structure of the article is not changed.
Yes.
Almost
So the study design does not affect the articles. Yeah. How the articles varies?
It can be only regarding the method or the type of the study that you did your article.
Okay. Okay, so let's answer the question then. I need to cancel the annotation. Okay, so let's answer the question and let's see if you guys know. So the articles varies depending on the journal preference, because each journal has a style, and each journal has a content, and each journal has a layout, and each journal has an order, like how they order the structure of the article. So the articles may vary depending on the journal. So a New England journal is different from American Academy of Pediatrics, is different from Canadian Pediatric Society. And also it varies to the institute affiliate with the journal. So the names that giving, so sometimes you say method, sometimes you can say methodology. So the name of the section may vary depending on the journal. Also the length of the section. So some journals like a big introduction, others like short introduction, and you might have lines restriction and number of words restriction. Also the field of study varies. So medicine is way different from, for example, architect or archaeology. And what is the intent of the research? Intent of research can cause variation in the articles. And remember, medicine, nursing, public health, general science, the background is very long and the introduction are very limited. So these are the causes of variation of content of an article. Now the introduction, which is the purpose, the objectives, sometimes might contain the background and the rationale. And if you don't know what is rationale, the rationale is why you're doing the research. And mostly is written not in the manuscript, but it's mostly written in the protocol. And most of the protocol are the text submitted for RED approval. So please mute yourself. M.A. Muhammad Salman, please mute yourself, please. Again, the introduction varies, okay, and the introduction contains what is known, or what we call it the literature review. And it's also contain the final paragraph, which states the purpose and the objective. So if you need to read the introduction, go to the last paragraph. If you are the articles in your subspecialty, then you probably know all the literature review. You don't need to review them. So what you need to go to the last paragraph of the introduction, because it states the purpose and the objective of the study. So here, for example, when you read the last paragraph, how you read it? Remember, slow but active reading. So what is this study is about relation between cigarette tobacco on a woman with miscarriage. And who is the woman attending regional health system? And when, this is the date, and where it's mentioned, and how, and how it will tell you the study design. And finally, why, and it gives you the objective or and you can see the objective is the last part of this last part of the introduction. So this is the last part of the introduction. So when I read it, I go by slow but active reading, follow this sequence of words. So it's vital to remember, if you need to read the entire article, go to right away, go to the last part of the introduction, of the background, because it tells you exactly what is the study about. So what is a prospective study? Any volunteer? Any volunteer for the question? What is a prospective study?
Study future from now on.
Okay, so study the future. Okay, well, let's see. So now we'll go to the method. So method is a description of the study. So it tells you the study design, and it tells you from where we're getting the data, whether it's active or it's passive, and we will talk about the data later on for later sessions. It tells you about the population, about the sample size, about the randomization, about the selection, about the enrollment, recruitment, about the inclusion, about the exclusion. It tells you about the population. And it tells you how we select the subject, how we select the population. It also tells you what is the data element, what is the variable that are used in the study. And it tells you how the data are analyzed, what is the statistical analysis of the variables, and how, after analysis, how we present the data. And it tells you how we validate, how we test the data. So the study design, it can be one-time study, cross-sectional, we go and take the sample, or it can be retrospective. What is retrospective? So retrospective is observational, it's a description study, it's analytic, it's not analytic study. So what does that? There is a risk factor, okay, and there is a disease process. But the investigator came to study the effect of the risk on the disease after the disease occurrence. So if you can see here, the risk, you can see the disease, and you can see the investigator started after occurrence of the disease. And you have to go back to study the risk on the disease. So they call it recalling. So you ask the patient, when he got, for example, lung cancer, you ask him before the lung cancer whether he was smoking or not. Okay, while prospective study, you have an investigator studying a risk before the disease occurred. So now I will collect all the smokers and I follow them if they develop lung cancer or not. That's called. Both of them are descriptive study. Both of them are called cohort study, different from one-time cross-sectional study. And in prospective and retrospective, you can study the prevalence and the incidence. While in cross-sectional, you can only study the prevalence. You cannot study the incidence. Okay? What is the case control? That's a different study. So you have cross-sectional, you have cohort, but case control. In case control or case study, the case study are two types. So you're reporting a case, or you do a series of cases to report them. While, mute yourself, please. While observational study, you study either you do a case control or use a cohort. And as we say, the cohort is prospective and retrospective. So in case control, we use it for rare diseases, while cohort, we use it for common problems. And both of them, the case control and cohort, study the exposure versus non-exposure to relate that to the occurrence of a disease process or not. With other observational study is ecological study. So for example, earthquake or tornado or volcano, the effect on population. And we have interventional studies. Interventional study, when you do interventional, so you do intervention, it can be medication, it can be test. It's two types. Either you do randomization, okay, and you do non-randomization. So now the question to audience, what is bias? Any volunteer to answer what is bias? Any volunteer?
Alaikum.
What is bias? Alaikum assalam.
Dr. Rehan, with you. Bias is the error.
It's the error of what? Error in typing?
Error in the data.
Error in the data. Error on what? Error in data or like Transferring data from where? Error in collecting data? What error in data of what?
While collecting the data.
By collecting the data. No, it's an error in the methodology. It's an error in the study design. So let's see that.
Can I answer?
Yeah, go ahead, please. Ask question.
Yes, bias has many types.
What is your name before you go?
My name is Ronald Muhammad from Egypt.
يا أهلا وسهلا. تفضل اسأل.
لا, I'm not asking. I'm answering.
You-
Bias has many types.
Okay, go ahead.
Bias has many types. There is selection bias. There is information bias.
Yeah, we'll talk about it. But the question was not the type of bias. What is bias? So the question was, what is bias? So bias is an error in the study design, and I will show you. So in methodology, we mainly problem on methodology is the bias. And what is bias? Bias is an error in the search measurement due to inherent feature in the design. What does that mean? The error can be systematic, can be unintentional, can be random error. So, for example, so to understand, when there is something called selection bias. So when we do case control, so for example, I want to study a rare problem, like a rare disease, and I want to understand if that occurs more in young or old. So what I do is I select all the cases in 1 year, and then I compare it to try to match those of that rare problem, which means I will select the control. And if I select them wrongly because of study design, then I got selection bias. Another example. So you have case, you have control, and then you select the case, you select the control. So it's all depend on you. So if you put a design with not proper selection, you get a selection bias. Now, if you're monitoring, if you're doing a prospective, so you're doing cohort study. So you're starting to monitor a risk on a disease, and then you follow the patient. Okay? So because you're monitoring, if you do a problem in your design, improper monitoring, you get monitoring bias. Now, if you do retrospective study, that means you have a disease, and then you dig the disease, and then you look for a risk factor that happened before the patient gets the disease, because you will ask the patient. So if the patient cannot remember, for example, you have recalling bias. So another problem is you can have time bias. Okay, so if you do cross-sectional and you do morning, you go to the outpatient clinic and you start morning cross-section. But sometimes for example, the employee that's working in the morning will not come. So you have selection problem because you're not selecting the employee, you're selecting just the unemployed. So the time bias, the selection bias, and the acceptance bias, because when you survey, people might refuse. So you have these bias when you do survey. When you do randomization, if you're doing interventional randomization style, you can have a problem. For example, if you have 100 patients and you want to recruit them over 1 year, and you know that when you do selection, when you do randomization, when you have 100, you have from 0 to 100. So because it's improper, you can get any. And if you have a mixture of male and female, you might have the chance that you select the first 50 female. And because you select 50 and it's over time, you might have all the female during winter. And so the season become a co-founder with your gender. And therefore, to solve this problem, for example, you have to do block randomization. So that means randomization, you can have balance error. You can have systematic error, but you can have random randomization error. When we talk about randomization, you will understand that. Also, you can have similarity bias. So in addition to the selection and randomization and all this methodology, the method will speak about data analysis, how you analyze your data. You can use a software, and there are many software using to analyze data. Please mute yourself. And you will talk about the method of analysis. There are many methods, and the type, because the method depends on the type of data. So you have variable, you have dependent, you have independent, you have obsolete, you have number, you have countable, you have non-countable. When you talk about data, all should be described in the methodology. After you do analysis, and then you need to present your data. So also this, how you present the data, it's also described in the methodology. So you can present it as a percentages, or as a frequency, or as a rate, or as a other forms. And also in methodology, you do testing. So you test your data. And the most important is it significant or not significant, and the relation between the data. And we will talk about this again more and more. So here's the question. What is wrong will happen? What is the problem will happen in your article if you have inclusion criteria problem? What will be wrong in the article if you have a problem in your inclusion criteria? Any volunteer? Any volunteer? Okay, well, let's move to the next question. What is wrong if you have a mistake or an error or a problem in your exclusion criteria?
Some data will be missed.
No, what's your name and which question you are answering?
I'm Yusra,
Okay.
pediatric registrar.
Okay.
I'm answering about exclusion criteria.
Okay.
Something wrong in exclusion criteria. Some data will be missed, or some samples.
You are close, but not absolutely right. Any other volunteers? I have a problem with my computer. It's shaking. I don't know why. Okay, so let me move fast. So inclusion criteria means sample size. So if you have a problem with your inclusion criteria, you will get a problem in your sample size. So if you restrict your inclusion criteria, you need to have big sample size to get so you need to test major population. But if you make the inclusion criteria relaxed, then you need less sample size. If you have a problem in your inclusion criteria, you get a problem in your sample size. If you have a problem in your exclusion criteria, you get more bias. Okay? So more exclusion criteria, less biased you are. And because you limit the confounding variables, and if you don't understand what is confounding variable, you have A and B. You have relation between A and B, and you have relation between C and D. Okay? If you're studying the A and the relation between A and C, both will be affected by B, and B is a confounding variable. Now the question, what is hook? When the hook will be good, which part of the article the hook is good, which part of the article the hook will be bad. And I have a funny question. Who is famous person right now in the media who is doing lots of hooks? Any volunteer? Any volunteer? Anybody can answer this question? Okay, well, you will see the answer in the end. So when you study the abstract, most of the article, one of the journals gives you about 200 to 500 words when you write your abstract. And the first part of the abstract is the gap. So what is the researcher will do to fill the bridge, or to bridge between known and the unknown. The second and third line will tell you the objective, the purpose, what, who, and when, and where. The next three lines will include the methodology. And the rest of the line, you have to write it to keep it less than 50 if the journal asks you like it about the result and the hint or the impact of the study. And last line will be the conclusion or future direction. And here is the hook. Hook will come here. And hook is when you look at the media, and let's say we are now COVID-19, and everybody is interested about treatment. So let's say you'll have, okay, we'll find a cure. Hydroxychloroquine is a cure. We know very well that hydroxychloroquine is not a cure. This is a virus. This is an RNA virus, and there will be no treatment. And then they start another medication. And then they say there will be a vaccine. But we know the vaccine will not develop in less than 12 months. So that's called hook. It is an exaggeration of words. So when you say, I am a pediatrician, but you can say, I am a wonderful, great, very good pediatrician. That's a hook. You're exaggerating yourself. So hook is the shortness of an article. Okay? And when the hook is bad, when it is in the abstract. When the hook is good, it's in the discussion. So when the hook is in the discussion, it's good. Because you're discussing. You are not giving a fact. You're discussing. You might be wrong. So here you can put a hook. But if you put the hook in abstract, then there's a problem. So when I do peer review and I see a hook in the abstract, I reject the article right away. So the person who's making lots of hook is President Donald Trump. We did that test for, and we did 1 million of tests. We have a cure. We found, and China did some like that. So lots of hook from President Donald Trump. So I have a question. What is the difference between recruitment and enrollment? Any volunteer? Any volunteer? What is the difference between recruitment and enrollment? So I'm going to continue then.
Hello, doctor.
Yes, go ahead. Answer the question. Name and answer.
Yes, my name is Priscilla Haddad. I think that enrollment is when a person voluntarily decides that he wants to enroll in a certain, when he voluntarily decides that he wants to join a certain activity, and recruitment is when the host, let's say, launches a certain application, and a lot of people apply for this certain position, let's say.
Very good try, but no. Okay, so I will tell you what is later. You will understand it. So the result, the main example of the result will speak about the sample size. So when we talk about sample size, we talked about recruitment versus enrollment. Recruitment is when your subjects are eligible. So you have eligibility criteria. Then you said, for example, I will take all the patients admitted to an ICU. So when the patient admitted to an ICU and he met the recruitment criteria and he precludes the exclusion criteria, that patient is excluded, that patient is recruited. Okay? And in other words, go and take consent from the patient, then that patient should be considered recruited. When you give the arm or you start collecting the data, so if you're doing a randomized study with 2 arms, treatment versus no treatment, and you give the treatment versus the placebo, for example, you are enrolling the patient. Okay? So the difference between enrollment and recruitment is, we call it consenting rate. So if you have 100% recruitment and 50% enrollment, then your consenting rate is 50% if the loss is only due to the parent denying the consent. So the recruitment is meeting the inclusion criteria, precluding the exclusion criteria. Enrollment, starting collecting data, or start giving the intervention if it's an intervention trial. So, and then you have subject loss. The subject loss because of the consenting form, or because your problem, for example, patient withdrawing the end, or patient maybe pass away, or maybe patient develop something that contaminating your result, and you take him out. Okay? And the result also talk about the study design. And it will talk about randomization, the difference, the problems in the randomizations, and it will talk about the intervention. And it gives you the demographic features of your sample. And the result usually present in objects, in figures, tables, and facts. And when you talk about, when you read a result, look at the tables, look at the label, and look at the units. Okay? Look at the range of the values. So for example, if you have a histogram, you will have the range of the values and you have the percentage. Okay? And please remember, when you look at the table, look if there is zeros. When the X and Y meet, is it zeros or no zeros? Very important when you review the article. Okay, look at the legend of a table, which is a subtitle that describes the table. Look at the footnotes of the table. And look at the flow, the logic of a presentation from recruitment to enrollment to the analysis to the collection and so on. And remember that there will be an exchange between the result and the discussion. Okay, sometimes there will be an exchange or confusion. Now the question is, what are the 2 parts of an article where information can be exchanged? I just said that. The question is, any volunteer, what are the two parts of an article where the information can be exchanged?
The result and the discussion.
The result and the discussion, correct, absolutely. So what is the discussion? The first part of the discussion will summarize the overall finding of the result. Then the discussion will focus about the implication, the limitation, the strength, and there will be a hook. That's the place where you find the hook at the end of the discussion. And the hook is very important because it tells you the future direction. It tells you the fantasy thinking of the researcher. It's very vital to understand the hook. And the hook, they call it, it's an out of the limb or out of a limb. It's an exaggeration of the finding. It's a show business of the article. Okay? So finally, do slow but active reading. Identify those words sequence. Remember, when you read the abstract, you will miss lots of information. Remember, the last paragraph of the paragraph is vital before you go to the abstract or the methodology. First few lines of the question summarize the result. Method is the clue for design. Design is the clue for bias. And knowing the bias make the result review very fair. So let's practice. What does that mean? So now we'll practice and probably you'll start to understand whatever I said. So let's start with the abstract. Now we've talked about the title. You use the acronym PICOT and then review on the first session and you will understand it. So you can see in the abstract there is few lines about background. And it tells you what is unknown here. And there is few lines about the methodology. So you can see the type of data. You can see the population. You can see the randomization. You can see the primary outcome. And you might see the secondary outcome. And then from the methodology, the result moved to the abstract moved to the result. And in the result, you see the enrollment. Okay? And you can see there is primary outcome. And you can see there is secondary outcomes in the result. So the enrollment, the primary and secondary outcome is in the result, a result of an abstract. And then you have the conclusion. So look at this beautiful conclusion. And I know this is a very good article. The result of the study support the consideration of CPAP as an alternative to intubation and surfactant in preterm infant. Very fact, you know, absolute fact. There is no hook here. And so I know this article is very good. Yeah, is that clear? Okay. So let's move to the introduction. So in the introduction first, you will see what is known. So you can see here you have an article. You can see there is another article, third article, and so on. So it tells you about the fact about CPAP and surfactant and why we're using them and what's the complications and so on. So it tells you what is known. Okay? And second part of the article, of the introduction, it tells you again what is known. Sorry, what is so you can see what is the problem here, what is the gap, the second part of the introduction. And then the last part, it tells you, so known, unknown, and then it tells you the gap that the researcher will use to bridge the relation between the known and the unknown. Okay, and now we will move to the methodology. So you can see in the methodology there is study design, and you can see there is arm. So you have two arms, arm 1 and arm 2, because this is an interventional study. And you can see that there is an outcome. And you can see there is a primary outcome, and there is a secondary outcome, and there is data analysis. Okay? So you can see that in the result, there is the demographic and the characteristics of the sample size. You can see there is a primary outcome, You can see that there is secondary outcomes. So when we go, you can look at the demographic. When you look at the demographic, you can see the date and time. You can see who. You can see the population type. You can see there is figures and there is table. So this is how I scanned this study. You can see more. Okay? And if you continue with the primary outcome, you can see in the result there is significant testing, the p-value, and we'll talk about the p-value later on in the course. So you can see it's no significance. So it talks about p-value and the level of significance. And also secondary outcomes. So also again, p-value, okay, and the tables and level of significance. And when you look at the tables, remember, this is the table 1, demographic. Most of the study will have this table. It tells you the characteristic of your population. And it's another, like table 2, you can see this table 2, most of the time, it tells you the analysis. So you can see arm 1, arm 2, the relative risk, and the adjusted p-value. We'll talk about the relative risk when we do the analysis of data. So you can see most of time in table 1, you take demographic study, demographic data of your sample size, the characteristic of your sample, and table 2 usually tells you the significance. And again, more secondary outcomes, but sometimes they present it in a graph. So when we do discussion, you can see it's a summarize of results. First part is summarization of the result. Okay? And it tells you the gap, the study finding. And also in the discussion, it tells you possible explanation or the researcher review why this happened. Okay? And at the end of discussion, it summarizes everything. So these are the references, and we reviewed one article. To make it better for you, or to make it more understand, I will start asking questions and see if you guys remember. So now, what is slow but active reading? Any volunteer? Any volunteer?
Yes, Rula.
Yes, go ahead.
So, but active reading is to answer all the questions: what, who, why, where, when.
Okay, so you scan to answer these questions. So you have a frame in your mind, and then you read to answer this frame. You don't read the whole article, because if you continue, you have to read it all. So that's mean you scan to answer something in your brain. And there is a say in English, say the eye cannot see things which is outside the brain. So if these words are in your mind, so what I suggest to you, when you start to read, put this in your mind, these words. And how you take it? Because I will post it on YouTube. And then go and try, when you read, look at these parameters. Okay? So these are the words that you are looking, the sequence of words that you are looking when you do slow but active reading. So you'll do slow reading, but you will short your time. So the question, how to assess the title? Any volunteer? How to assess a title of a study?
Rula.
Go ahead, Rula.
إنه to assess the title. To assess the title is to answer the first.
No, Rula, you don't know probably. Any other volunteer? Any volunteers? Nobody saw the first session. Any volunteers?
Hello.
Yes.
Hello. Dr. Dilip. Hello.
Yeah, your name and your name.
Dr. Dilip.
Okay, go ahead. Answer the question.
So basically, title should answer the acronym PICAD. So population intervention comparison.
So that's one part. That's one part. Yes, you assess by one part. That's one pillar. What's the other pillars? Do you know?
I'm not sure.
So let me answer the question. Probably you need to review the first session. So to answer the title, to assess the title, you have three pillars. First is the acronym PICOT, you said it. Second is the target. Third is the best evidence of practice. Okay? So the targets are 6. okay, which is diagnostic, interventional, therapeutic, treatment, something diagnostic, and so on. So you have the target in your mind. The second is the PICOT, which is population, intervention, comparison, outcome, and time or study time. The third pillar is evidence-based. Like, for example, because I can have very good target, I have very good PICOT, but I want to do a study about obstetric. Well, I have no experience. How I can? So you need an evidence practice. So the evidence practice have three pillars. First is good research, good review. Second, you need to have expertise. Third, you should have patient preference, patient values. So these three make one pillar, which is called the evidence-based practice. The second pillar is the target of the study, and third is the PICOT. And if you put that and you practice, you can assess the title. Okay. So the third question is, what is the last part of the background talk about? Any volunteer? Your name and answer, please. Yes, go ahead.
Hello?
Yeah.
Yes.
Go ahead.
Hello?
Go ahead, I hear you.
Yeah, it was about the
You're interrupted. You have interrupted the voice. So let me answer the question.
Please.
Yeah, go ahead, answer.
Banusat from Iraq.
Okay.
Background, we compare for what's known and what's unknown.
The last part. The question is, what is the last part of the background talk about?
I think it is about the what you achieve in your study.
What is known?
Comparing.
Known, and you have what is known, and then you have the gap. So you mentioned the known, you mentioned on the known, and then the last part will talk about how you will achieve that. What is the gap between the known and between the unknown? Okay, go ahead.
We compare between what we know and what we achieve.
We do not compare. We compare only in the discussion. We do not compare. So we say what is known. For example, we know that in the RDS, surfactant is very good. We know that CPAP is very good for RDS, but we don't know which one is better. So, so the known is that we know both are effective, but we don't know which was better. This is unknown. So what I will do, I will compare both of them, the known to unknown. So that I will do a comparison between them. Okay? So that will be my gap. So that will be my last part of that. So the next question, what is hood and where should be placed? Or placed, sorry, misspelling. Any volunteer?
Hello, I'm Dr. Dilip. Hello.
Yeah, go ahead, Doctor. Go ahead.
Hello. Okay, so I think it is hook, or is it hood?
No, hook. Sorry, it's a typing error. Hook.
Okay. So ideally, it should be placed in the discussion part, the hook, in the last part of the discussion.
Yes, very good. When it is not good, when you find a hook that is not good.
In the background, in the introduction part, if it is in the introduction part.
In the abstract.
Abstract. Okay, abstract.
If you find the hook in the abstract, like a TV portrait, a TV title in the abstract, you know that this study is not good. Okay.
Okay.
Where to find the primary and secondary, primary outcome and secondary outcome or outcomes? Any volunteer? Where to find the primary and the secondary outcomes?
Hello?
Yes, your name and then answer the question, please.
Dr.
Yeah?
In the result?
You will find the primary outcome and secondary outcome in the result.
Yes.
Yes, are you sure?
No.
You're not sure. You'll find it in two places, right? In the result, you will find the fact, and you'll find them in the methodology, the description of the primary and secondary outcome. So you'll find the description of the primary and secondary outcome because it's part of the study design, and then you will find the result, the fact about the primary and secondary outcome in the result. Okay. What the effect of inclusion criteria? Any volunteer?
Ruda.
Yes, go ahead, Rula.
The inclusion criteria, it's where you put the...
Now, what is the effect of the inclusion criteria? On what the inclusion affects?
Hello?
Yeah,
affects your population.
Rula, affect what?
Population, your population.
Yes, sample size, not population, yeah. Because remember, I think I gave you a lecture in US. There is a population, there is a targeted population, and there is sample size. So the inclusion criteria will not affect the population. So for example, if you want to do study in Emirates, and you say, I will select, for example, the Japanese in Emirates, that's your population. But then you will say, no, I will select the Japanese who live in Sharjah. So that's your targeted population. But you cannot take all the Japanese in Sharjah. You need to do a sample size to represent Japanese in Sharjah. That's your sample size. So you have population, targeted population, and sample size. Your inclusion criteria will affect your sample size. You're right. So if you restrict the sample size, you need lots of targeted population to get the sample size. If you expand your inclusion criteria, you need less sample size to represent your population. Your study will be easier, but you'll have lots of confounders. Okay, so the question, what's the effect of inclusion criteria?
Yes, sorry. The effect is the bias.
Who's this? Who's this?
In the bias, Dr. Isa.
Dr. Isa. So the exclusion criteria is the bias. Who's next? Who wants to answer?
A bias.
Okay, I got you. Who's the next? You want to answer before I answer?
Confounding of limited exclusion.
So what is the inclusion criteria will affect? Sorry, what's your name and what's the answer?
Before one. Exclusion criteria,
Okay.
is selection of limited exclusion.
Okay, so let me answer it. The exclusion criteria will affect your bias. So if you have lots of exclusion criteria, you get way better and less bias. If you have your lessening, decreasing your selection exclusion criteria, you'll get more bias. Can you mute yourself, please? Try to mute yourself. Please mute yourself. Asus, mute yourself, please. Mute yourself, please. Asus, mute yourself, please. Okay, so what is the question is, what is the type of study design for rare diseases or any volunteer? Mute yourself. Case study. Yes. Why it's a case study? Use what do you mean by case study? You mean case control, you mean? Do you need a case control?
Case control.
Yeah. So the study is designed for rare disease case control. And the reason why, because it's rare diseases and you need to select them. You cannot get very big, you cannot take all the population to get your sample size. So you have to select your patients. And because you're selecting them, you need to select the comparison. So it's a case control. You select the comparison. Please mute yourself. You are in our room and you're chatting with your friends. So mute yourself. Okay, and I think I am done unless you guys have a question. Any question? Any question?
Hello, Dr.
Yes,
Here.
go ahead.
Hello.
Yes.
I'm Dr. Dilip. Can I ask you one thing? Initially, you told about one subject loss. Is it the same what we call attrition rate? Is attrition rate the same? In some.
So, sorry, there was interruption. So, can you
Okay.
Can you repeat the question?
Okay. When you talked about something called inclusion criteria and exclusion criteria, and some subjects which we include initially when we start a study,
okay,
cannot be included ultimately. Some subjects will be lost to follow up, and is that what we call attrition? I have seen in some.
So I will make it very simple because I don't want to speak about the study design right now. I will speak a very discussion about the study design. But inclusion criteria is the recruitment. So when you put an inclusion criteria, it's the gate or the window. Same person, his name Asher, I will remove him from all the sessions next time. Dr. Asher, I will remove you from all the sessions next time. So again, the inclusion criteria is the window or the gate to which you enter the study. So for example, I want to do a study about people passing a traffic signal. So I will stand and I will see all the people passing the traffic signal. That's my inclusion criteria. But I will say, no, I will exclude the white car, the red cars. That's my exclusion criteria. Okay? So the difference between inclusion criteria and exclusion criteria, for example, if I say all the cars that pass through this traffic signals, okay, I have very big sample size. I will have no problem. I can do very quick study. But I will include everything, everything. Okay, I will include the salon, I will include the truck, I will include the white car, all are included. So I'll get easy sample size. But I will have lots of confounders because I am intending to study the white cars. But if in the when my inclusion criteria affect my sample size. But when I put more exclusion criteria, it will remove all the bias or all the bias and all the confounders. The other terms that we use in study design we'll be talking about in study design. But right now, just understand this. Any more questions?
Yes, can I ask a question?
Go ahead, please.
I want to clarify the difference between cross-sectional studies and case-control studies again.
Okay.
In brief.
I will mute everybody and ask. So case control study is, I will give you an example. So for example, if you want to study bronchiolitis, and you want to study the effect of smoking on bronchiolitis, you cannot do case control. You have to do a cohort study. And if you are only observing, you do a cohort study. If you want to do something to the bronchiolitis, you do interventional study. Okay? So, but if you want to study a rare problem, let's say you want to study the effect of, let's find one of the rare problems. Let's talk, you want to find the effect of consanguinity on Joubert disease. Okay? So the Joubert disease are very rare. To study all the population, to find a Joubert disease, probably you need 6-7 million to find. So what instead you do, because it's a rare problem, you go and look all the Joubert disease in the country. You study them, and you will find all the risk factors associated with them. And then you look to the risk factors and start to find a comparison who having all the risk factors, but they don't have the disease. So you start to compare the risk factors of the Joubert disease with the risk factor of the control. So that's called case control. So you select the cases and you select the comparison to be equal in the risk factor to the cases. So that's called case control. Okay? So now you try to study the happiness of a people passing through a street called Red Street. So you go there and you stand there and you start to ask a question of everybody passing through the Red Street at that time, at that date, how do they feel? Are they happy or sad? That's a cross-sectional. So now the sample size that you're getting, depending on if they agree or not, because they may say, no, I don't want, or it might be affected because certain time of the day, certain people pass, or because in that street, only certain type of characteristic population pass, so only the youth are coming here because there is a club, for example, or only elderly is coming because there is a mosque. Okay, so the location, the time will affect, and also the acceptance will affect your son. That's called cross-sectional. So it's one time, one shot study. So case control versus cross-sectional study. Did I answer your question?
Yes, thank you. Thank you very much. Thank you.
Any more questions? Any more questions?
Yes, is that a question, but not about research? How are we going to take our certificate, if you don't mind?
Well, I have now the list of people who attended. Okay, and there are 14 lectures. So if you attend 80% of them, you get the certificate. So now I have the list of attendees. I have the list of all people who attended today, because the system will make them. The system will make them in a. So we have Dilir, we have Van, we have Muhammad. Okay, and I have all the list of people who attended today, and then I will see every day or every lectures. And then I will give you the certificate if you attend at least 80%. Did I answer your question?
Can I ask a question?
Go ahead, please.
I have a bad connection in some parts of your lecture. I want you to explain to me more about the hook. I don't get it.
Okay, the hook. I will tell you the hook. So let's say you are reading about the effect of omega-3 on the memory. So that's an example. And you're reading a study that's done on 8 population. And in that study, the researcher gave the people omega-3. And then he assessed, or she assessed, the memory on January. And then after 6 months, on August or on June, she assessed, the researcher, or he assessed the population, these 8 populations. And how she assessed by measuring a chemical. And we think that this chemical might be linked to the memory. So she found that that chemical, compared between January and June, is high. And because that chemical is high and that chemical is linked to the memory, she thought that omega-3 improve the memory. So she says, what she will say, we find it. If you want to improve your memory, if you want to pass the exam, if you want to do a difficult, solve a difficult problem, take omega-3. That's called hook. You're exaggerating the finding. But when we go and read the study, it's a very small sample size. Okay? And the other thing, she didn't measure the memory. She measured chemical attribute to the, right? Other hook. I will tell you other hook. For example, you are studying the effect of or the comparing a drug A on drug B. and there is previously studies done on A and B, but never compared. Okay? So, and then in your study, you didn't find the difference between A and B. But in your hook, you say, the A is a great treatment. It's been done and it's compared. But this is known. This is not your study. So you're giving the hook. So the hook is the TV title of, so we found a cure of COVID-19. We have the medicine. The medicine will solve, this medicine will solve everybody. But when we go and talk about hydroxychloroquine, it's actually, there is no study saying that. So that's called a hook. You don't say the fact, okay? You exaggerate. Or you can say another hook. I will tell you hook. You created a robot to do a surgery. And then you will say, but that robot is doing very primitive surgery. So you will say, oh, after 20 years, the robot will replace the surgeon. That's a hook. Because actually you don't know. That's what you think. That's called a hook. Okay? So the hook is the conclusion, but exaggerated. And the hook is good in the discussion. The reason because other people might take it and actually make it a research, future research. So the hook is talk about exaggerating your finding, about what do you think about your finding, about what will happen to your finding in the future. But it's not your finding. Your finding is your conclusion. Did I answer your question?
Yeah, so we sometimes write it in the recommendation because it's a recommendation.
Right? No, it's not recommendation. A hook is not recommendation. Hook is exaggeration. So recommendation, if you say you're studying effect of problem A with B, and then you will find there is no difference. So you recommend that you can use this and you can use this because no difference. If you find B better than A, so you recommend A treatment. That's a recommendation. But hook, no, you're exaggerating your result. I will tell you, you have treatment A better than B, but the difference is only 55. So you say, please leave A, use only B. That's a hook. But if you say no, if you use A, B instead of E, you have probably 5% more benefit than A. That's the fact. But if you want to do hook, okay, B is way better than A. Use A, B, and forget about A. So that's hook, and that's fact. On comparison, you say, no, I found there is a little bit of difference between B and A. So if you use B, then probably you have a better success rate than A by 5%. That's a recommendation. So you have hook, you have fact, and you have a recommendation.
Thank you. Thank you.
Okay. Any more questions?
I think the question is about
your name because you.
My name is Rami Muhammad from Egypt.
Yeah, because you logged in your email, and your email, I won't say your email. So next time, please try to log in your email, because now I will not recognize your name, and probably I will not count you, because the system will count you. I will not count you are attending, because you need to attend by your name. Yeah, go ahead, ask the question.
You consider me attending this lecture or not?
No, the system will not count you. But I will try to write your name manual, because remember, we said please log in with your official name, so I can track you. I have now logged in, for me, like 75% logged in. So I will not able to track all of them, who's who. The system will track them and make Excel sheet to me. So if you don't log in with your official name, how I will give you the certificate? I cannot write in the certificate Conan1983@hotmail.com.
Yes, but I registered with my name.
No, if you registered with there is some problem with your registration. If you problem with your registration, if you can ask the help of our colleagues, better for you. Or I can do a session with you how to register.
He gave me 3 pages, one from my first name, last name, and my...
Yeah, you might do something, but the result is not your name. I cannot see your name. Anyhow, ask me a question. I will solve this problem later on. What's your question?
Okay. I saw the question. I'm asking you to count 80% from this lecture, because I didn't hear about the previous one.
Okay, so the previous one, you go to you can go to the YouTube, okay, and the 80% selection is not from me, because remember, no, I am not giving you the certificate. There is an organization affiliated with me to give the certificate, because I am a person, I cannot give the certificate. And they put that recommendation that if you attend 80%, you deserve a certificate. So it's actually an Egyptian organization that I'm affiliating with, and the recommendation from them. So you can contact them to change that if you want. Or I can repeat the lecture and you attend it. So we can solve that.
Okay. Can I send you my name? I write it in WhatsApp.
I will repeat the lecture the first, because some of you will not attend. And if you attend, the system will count you. As I told you, it's a 14 lecture. It's zillions of people. I cannot send it manual. You have to log in with your own. And we said many times, please do not write doctor in your name, because we know all of you are doctors. Now, Dr. Caroline, Dr. Muhammad, Dr. May, we said many times, I've posted linking 10 times, please do not put a doctor in your name, because the system will log, it will go to D, and actually Caroline is C. And for Dr. Muhammad, it will go to D, but Muhammad is in M, and May is M, but D is in. So please don't put doctor in your name. You just write your name, so we can write, the system will recognize you. Because right now I cannot recognize Caroline, I cannot recognize Muhammad, I cannot, because they put also the people who logged in by their email. I cannot recognize them. You have to log in with your name. If you don't know, ask colleagues. Okay, any more questions?
I will write my name for you and WhatsApp.
No, it's we're done with that question, Doctor. Let's go to another question. Any more questions?
Yes, one question.
Your name and your question.
Rehana Shafi.
Okay.
Initially, I also registered with the doctor, but later on I changed. So I am counted in that?
I cannot count you. It's automatic. I don't know.
But in the email I got email.
I told you again. There are many lectures. There are many people, and I'm not giving the certificate. I posted very clearly. Please log in with your official name, and please do not put prefix. Do not prefix, and I mentioned specifically doctor. And despite that, people are logging with their names, okay? And you can see the system will not recognize your name if you're using the first letter as lowercase. The first name should be, as you know in English, the first name should be capital, okay? So if you please consider all that when you write your name. The first letter should be capital, and you write your official name in your certificate so you can get the certificate. If you're writing only one name, you will not get the certificate. If you're writing email, you will not get the certificate. If you put a doctor, you will not put a. You need to log in with your official name. Now, if you cannot do that, I can't do anything for you.
Thank you.
Yeah. Any more questions?
Muhammad, I'm asking about the sample size.
Okay, go ahead.
Or the sample size.
Yeah, go ahead.
How can we appropriate sample size, least accepted sample size to get meaning for the system?
So that's called sample size calculation. We have a lecture, a session, complete session about how to do a sample size calculation. There are 7 factors in the sample size calculation. There is population, there is target population, and there is sample. There is the power of the study, there is the confidence interval, and there are many factors, and there is the study design, okay, and there is the sample, there is the outcome, and the primary and secondary outcome. All these will affect the sample size. So when we take the session about sample size, you will understand it very clearly.
Okay, thank you.
Okay, any more questions? Should I close, or there is more questions? No more questions? Well, thank you very much for your attendance, and please and kindly write your name correctly. Your official name, no prefix, not your email. Your first name should be in a capital, start with capital. Your second name should be in capital, okay? And you should write in every time you enter, same way, because the system will not match you, okay? So please remember that when you log in. One name is not acceptable. Word prefix, professor, doctor, miss, Mr., you should not be in your name. Your first letter of your first and last name should be capital. The rest of the name should be lowercase, small letters. And the name should be always the same, so the system can track you. If you don't concern about the certificate, then don't worry about it. You can enter in any way you like. Okay? Well, thank you very much, and I'm going to log out. And I will record this for you in the YouTube. Thank you very much again, and have a good day. Ramadan Kareem for everybody. Please stay safe. Keep distance. Mask. And wash your hand. Put gloves. Hope you are all safe and passing this crisis. Okay? Assalamu alaikum.